have checked the physician's orders. I've done my hand washing. I'm going to knock.
Hello.
Hi, my name is Tanya. I'm going to be your nurse today.
Okay.
Can you tell me your name and your date of birth?
Bailey Kuby on August 3rd, 1999.
All right, great. And I'll be grabbing my materials, and then we will perform the head-to-toe assessment. All right. And a health history has been taken already, and overall appearance of the patient is good. And vital signs, height, weight, BMI has been calculated, and that's it. Can you tell me why you're here today?
I'm here for a physical assessment.
Can you tell me what season it is?
It is spring.
That's right. Okay, so her level of consciousness is good. She's alert and oriented ×3. Her speech and communication is good. Can you grip my fingers? Can you pull me? Can you push me away? Very good. So the grips are equal bilaterally. Now we're going to check her plantar flexion. Can you put your toes down to the ground and then back up towards you? That's great. They were equal bilaterally. Right now we're going to test the 12 cranial nerves. I'm going to start with the first nerve, which is the olfactory, and we're going to do a sniff test. So if you could close your eyes and occlude one of your nostrils, and just let me know when you can smell this.
I smell it.
Okay, and now your other nostril. Tell me when you can smell it. All right, very good. So the first cranial nerve is intact. The second cranial nerve is the optic nerves, and we are going to check that. Just want you to look straight forward. I'm just checking to see that both pupils are constricting at the same time. Very good. And then we're going to check your fundus. Nice and orange. Nice and orange. So the next thing we're going to do is check cranial nerves 3, which is oculomotor, 4, which is trochlear, and 6, which is abducens. So I want you to just look straight forward and just follow my pen, just with your eyes. Very good. Very good. So all those are intact. So now we're going to check the 5th nerve, which is the trigeminal nerve. And I'm just going to have you close your eyes. I'm going to touch your face, and you're going to tell me if it's sharp or soft.
Soft.
Mm-hmm.
Soft. Hard. 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 Soft. Hard.
All right, so everything is intact there. Now we're going to do the 7th cranial nerve. So I want you to smile, puff out your cheeks, raise your eyebrows. Very good. All right, and then the next one is the vestibular cochlear, or the acoustic. So what I want you to do is plug that ear, and I'm going to say something, and you're going to tell me what I say. Bailey.
Bailey.
Now, your other ear. Football.
Football.
Very good. Okay, so the next one is the 9th cranial nerve, and that's the glossopharyngeal. So if you could just lift your head up and then swallow for me. Very good. And then the 10th is the vagus nerve. This is your gag reflex. So if you could just open up, say ah. Very good. Nice. And then we have the 11th, which is your accessories. So I'm going to put my hands here, and I just want you to push against me. Very good. And against my hand, and the other way. Very good. And then the last one, the 12th one, is the hypoglossal, and we're just checking for muscle deviation on your tongue. So if you could just open your mouth and stick your tongue out. Perfect. Very nice. Do you mind if I touch your head and inspect it? You have any pain?
No. No pain.
All right. I don't see any lesions, no infestation, and no pain, right? Okay, good. And I'm just going to look at your eyes. I just want to see position alignment. It looks good. You're symmetrical. And I'm just going to look at your eye for a minute. The conjunctiva is pink. Sclera is clear, white, nice. And the color is normal. Let me see your eyelids. No lesions, no drainage. Color looks good. Everything looks good there. And your eyes are, they are perla, and the size is about 4 millimeters. And the fundus in your eye, we already checked that, cranial nerve 2, and it was nice and orange. And when's the last time you had an eye exam?
About 3 weeks ago.
Okay, that's good. So then the Snellen chart is deferred. We don't need to check that again. And when we had checked your eyes before, 4, 3, 4, and 6. You had no nystagmus, no lid lag, you don't have any ptosis. And do you wear glasses?
Yes, I wear glasses just to watch TV.
Okay, all right, well, thank you. Okay, I'm going to inspect your auricle, palpate it. Do you feel any pain?
No pain.
All right, now I'm gonna take this otoscope and I'm just gonna look in your ear if you don't mind. All right. Tympanic membrane is nice and pearly gray, and wax buildup is within normal limits. Same there, looks good. And we already did the whisper test for cranial nerve 8, so we know that's intact. And we did the sense of smell for cranial nerve 1. So can I just look up your nose for a second just to make sure there's no deviated septum? That looks good. And then I'm just going to palpate your sinuses. Just tell me if you have any pain, okay? So we have the frontal sinuses here. Any pain?
No pain.
And maxillary, does that feel okay?
No pain.
And then the ethmoid. Is that good?
No pain.
All right, thank you. I'm just going to assess your mouth. So I'm looking at your lips and they're nice and pink and there's no cracks or ulcers or anything visible. Can I just look in your mouth? All right, the oral membrane is intact. It's nice and pink. The teeth look good and white. And let me see your tongue one more time. Yeah, the tongue looks good, no bumps, anything like that. We already assessed your swallowing when we did the cranial nerves, and your overall hygiene looks great. Can I just look at your lymph nodes? Test your thyroid? Just feeling for any lumps. Any pain?
No pain.
All right, no pain there?
No pain.
All right, great. Okay, so now I'm just going to assess the appearance of your skin. It looks good, everything seems intact, and you have no lesions. Moisture, temperature, texture looks good. Just check your skin trigger. That's nice. That means you're well hydrated. Vascularity looks good. No edema. Let me see your capillary refill. Capillary refill is good within 3 seconds. And no nail clubbing or anything. If you can lift your arms for a minute, I'm just gonna check here. No pain?
No pain.
All right, no lumps. You look good and hygiene is great. Okay, so now we're going to do the respiratory, and we did your O2 sats already. You were at 99%, and your respiratory rate was 15. That's good. And just take a deep breath for me. Just going to inspect. Looks good. The breathing is good and symmetrical. Do you have any coughing?
No coughing.
Sputum?
No sputum.
Okay. Are you have any shortness of breath or anything?
No shortness of breath.
Okay. I'm going to do tactile phremesis now. I'm just going to put my hands on you, and when I do it, I just want you to say 99. I'm just checking that the resonance is the same bilaterally.
99. 99. 99.
Okay, I'm just gonna go over to the back. And again,
99. 99. 99.
last time.
99.
Very good. Okay. And then I'm just gonna have you stand up for a second. Turn around here, and if you would just blow all your air out, and then take a big deep breath. Just checking excursion. Everything looks great, bilateral, it's all nice. And now, hop back up, and I'm just going to percuss. Nice, hear good resonance there. Very good. Then I'm just going to listen to you. Just take a deep breath. Thank you. I'm just going to listen to your back. Go ahead. Lung sounds are nice and clear. All right, thank you. I didn't hear any adventitious lung sounds, no crackles, wheezing, ronky. Do you smoke?
I've never smoked.
Okay, all right, thank you. Okay, so now we're going to do the cardiac assessment. I'm going to auscultate your heart sounds. And I'm going to start by listening to the aortic, which is at the second right intercostal space, and the pulmonic, which is the second left intercostal space. And then we have Erb's point, which is the third left intercostal space. And then the tricuspid, which is the fourth left intercostal space. And then the mitral area, the apex, which is the fifth left intercostal space. All right, everything sounded good. I heard S1 and S2, and there were no adventitious sounds. So we're just continuing on with our cardiac assessment, and just assessing her. She has no edema. Let me see her cap refill again. Cap refill is good, under 3 seconds. The color and temperature looks great. And now I'm just going to assess the temporal pulse. Yep, those are equal, bilateral. And the carotid, do these separately. And the apical pulse, very good. And the brachial pulse, everything has been good, 2+. And then the radial, that's good. If you hop down for me, I'm just gonna assess the femoral pulse. Put my hands right here. That's good, 2+. If you could turn around for a minute. The popliteal pulse. Yep, that's good. If you hop back up. Okay, and then I'm going to assess the posterior tibialis pulse. That's good. And then the dorsalis pedis. Very nice. All were 2+, and were in expected ranges. So do you have any issues chewing or swallowing?
No.
Have any indigestion?
No.
Any changes in your diet?
No.
Weight or anything like that?
Mm-mm.
How's your fluid intake been?
Pretty good. I drink a lot of water.
Okay. Have you had any diarrhea or constipation?
No.
All right. If you would just lay down, I'm going to look at your abdomen. First, I'm just going to inspect it for symmetry. Good. Looks nice and symmetric. And then I'm just going to auscultate. I'm just going to listen. And I'm going to start in the right lower quadrant, and the right upper quadrant, and left upper, and then left lower. All right, everything sounds good there. Normal active bowel sounds. And then I'm just going to percuss you for tympani. All right, and then lastly, I'm just going to palpate. Is there any pain there?
No pain.
Any pain here?
No pain.
What about over here?
No.
And here?
No.
All right, everything looks great. You can sit up and put your shirt down. Thank you. History of falls?
No.
All right, and her posture, stance, gait, and swing was all good, and I observed that when we did the height and weight. And can I just get you to stand up for a minute? I'm going to test your range of motions. If you could just move your arms out to your sides, and then stand on one foot, and then stand on the other. Range of motion and balance is good. I'm going to just check your spine for curvature. Spine seems good. No scoliosis, lordosis, or kyphodosis. And the muscle tone and strength was 2+, and we tested that earlier when we did your grips bilaterally. And then I'm just going to check your reflexes if I could. I'm going to start the upper here. All right, and turn your arm over. Reflexes are good here, and then your knee. Very good. And then I'll have you get on the bed. I'm just going to check the Babinski's reflex. That's intact. Good feet. All right, swing back around here if you could. I'm just going to check this knee. Very good. And I'll do these right here. Very good. All right, so all reflexes are intact. They look good. Do you have any pins and needles, numbness,
No.
tingling, coldness? Okay. And what about your activities of daily living? Has anything changed? Are you able to make your breakfast, eat, toileting, bathing? All right, that's good. And then moving on to genitourinary, how often do you urinate in a day?
About 15 times a day.
You drink a lot of water?
Yes.
That's good. Any pain with your urination?
No.
Okay. And do you perform monthly self-breast exams?
Yes.
That's good. And then psychosocial, patient lives at home with her family and you go to school, right? Okay, and then spiritual and cultural considerations have been covered. And I'm just encouraging you to continue on with your exercise programs, drink lots of water like you do. And is there anything else I can do for you today?
No, I think that's it.
Okay, and so then I just lowered the bed to the lowest level and gave her the call button, performed hand hygiene, and that's it. Thank you.